Good evening and thank you for joining us. This weekend, more Canadians are feeling a growing sense of freedom. Many shops and restaurants are welcoming back customers after being shut down for more than 2 months. But they're facing higher costs while operating at reduced capacity under new rules. As Morganne Campbell reports, some businesses are passing the buck onto consumers.
On any given weekend, this place would be abuzz with clients in salon chairs and chatter over blow dryers.
This is a regular surgical mask, which we're going to use.
But in the time of COVID, there are no regular business hours. This Toronto salon is preparing to reopen with a new business plan.
We're not making any money off this.
Extended hours, limitations on the number of customers allowed, improved sanitization methods, and a barrage of personal protective equipment. And it comes with a price tag, a $3 surcharge.
We came up to the number because it pays for the basic costs of what we're going to use.
Some businesses are tacking on a COVID surcharge as they navigate through the pandemic. COVID has hit retailers hard. New data this week from Statistics Canada shows about 40% of retailers closed their doors in March, but not all customers are willing to pay a little bit extra.
Why in the time where their own clients are facing financial uncertainty would they put an additional charge on to pay for their business costs?
Cassandra Brown says she was going to be charged an additional $10 for her appointment, says her Calgary dentist shoulders the cost of PPE. Consumer experts say surcharges may push customers away.
If they do seek charges, it should be made known to the public so we can at least have a choice whether to deal with that company or not.
Business experts suggest not many will implement a charge, and for those who do, it'll likely be a small fee.
I think that there are many Canadians that understand that small businesses are struggling just like they are.
The Canadian Federation of Independent Business conducted a survey of its members, which found that on average, business owners have lost about $200,000 since this pandemic hits. Robin?
Morganne Campbell reporting tonight. While more businesses are getting the green light to reopen, Canada's COVID-19 cases keep climbing, and the biggest spikes are still coming from 2 provinces. Today, Quebec recorded 697 new cases and 75 more deaths. And the rate of infection continues to rise in Ontario, with 412 new cases today and 27 new deaths. Most new cases in that province are now coming from community spread. The race is on around the world to develop a COVID-19 vaccine, but it is definitely a marathon, not a sprint. Abigail Bimman has an update on an experimental vaccine with a Canadian connection and other advancements around the globe.
For the 124 groups racing to produce a COVID-19 vaccine, there are 3 testing phases to work through, and a group with a Canadian connection just published positive phase 1 results.
It looks to see if the vaccine is safe in humans, and it also will look to see if people can mount an appropriate immune reaction to the vaccine. That means you're given the vaccine, and then your body does what it's supposed to do. It makes what's called antibodies.
That's what happened with CanSino Biologics' potential vaccine, tested on 108 adults in Wuhan, China. In the coming weeks, it will be tested on Canadians. Dalhousie University is a partner. If all goes well, the National Research Council could produce thousands of doses each week. But that is still a long way away. Dr. Isaac Bogosh is optimistic there will be a vaccine eventually.
Certainly, I don't think it's fair to compare the duration of time to creating a COVID-19 vaccine from other vaccines, because never before have we dumped infinite resources into a vaccine development.
This week, the U.S. announced it would provide up to $1.2 billion to drug company AstraZeneca to fund a phase 3 trial testing 30,000 Americans this summer. Friday, researchers at Oxford University announced they're ready to expand to phase 2. That vaccine would be manufactured in India. The Serum Institute is working with half a dozen candidates.
We're all in a race to battle the disease. There's no one-upmanship here. Of course, the sooner we get it, the sooner we can save lives. And, that's all we're trying to do here, and scale it up as soon as we can.
And even though we're still a far way off, experts say it's not too early to talk about logistics.
It needs to be thought through. Because what if the vaccine requires 2 doses, not just 1? to provide some degree of immunity. And what if the immunity only lasts a year and you have to revaccinate next year, like we do with flu?
So a lot of logistics yet to be worked out, as well as a lot of questions such as who would get it first and what to do about people who don't want to be vaccinated. Abigail Bimman, Global News, Ottawa.
The new series that goes inside the COVID-19 pandemic, from the front lines to the everyday heroes helping us cope with the unprecedented change. Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.